while everyone is joining us, just few good advice. Just in the beginning, as you can see my screen, it's today Huawei Business Meetings dedicated to food chain and healthcare use cases. I'm very happy to have on our side the Huawei experts that you will be able to meet personally in the end of this presentation on the matchmaking platform. Just few insights to begin with. You still have until 10 before 10 to accept the last pending request meeting. You have 5 to be accepted. If you want to have it, it was on Huawei demand. So please have a look during the presentation on your matchmaking platform just to accept the 5 last meetings. Otherwise, the more than 20 meetings are all set up. So it will be the easiest way afterwards to go on the platform and do your meeting as you want. For this presentation, few words on the logistics. You have please shut off your mic and camera. If you want to ask question, you can both use the chat on the Teams meetings or raise your hand, and no problem, they will be answering everything. This first presentation is recorded, so you will be able to watch it again, and then afterwards on your one-to-one meeting, it will be totally up to you. If you don't have any question, I'm happy to welcome my friend and colleague, Alexandre Thomas, responsible for the food chain and healthcare domain in systematics. Alexandre, the floor is yours.
Thank you, Lola. Hello, everybody. I hope everyone is doing fine today. We are gathering this morning, as Lola said, to meet the techno expert of Huawei Group. Huawei will first present to us its 2 use cases related to photonic in health and food sector, and then they will present in more detail their mode of privileged partnership with SMEs. Photonics in the food sector and health sector is increasingly present and represent very high impact issues such as faster and less expensive disease prediction or detection of anomaly or incidents in food production chain. We hope that today you will be able to meet qualified people either on the SME side, on Huawei side, and that this can lead to very good partnership. In the meantime, I will give the floor to the Huawei team to present their use case in more detail. Have a good morning, everyone.
Thanks a lot. If Huawei, you could directly share your screen, it will be the easiest way.
Yes, let me try. Good morning. Can you see the presentation?
Perfectly clear. Thank you very much.
Thank you very much. Thank you very much. Good morning, all. We are very happy to be part of this event. Let me start with a short introduction of our company. All of you know for sure the name of the company and the brand Huawei. We are very well known because of mobile phones, which are sold in over 170 countries worldwide. Huawei has almost 200,000 employees. It's a huge company, but what is very specific here, we have almost 100,000 guys focused on research and development. So half of the company is focusing on the innovations and new technologies because we would like to follow the trends and the state of the art and place on the market only the newest and the high-tech technology. We are located and spread also in Europe. We have almost 30 research centers spread all over the Europe. Today in the meeting, we have guys from Calliope in Belgium who are located in Ghent, and our mobile health team, which is located in south of France in Grenoble. In Grenoble, we have the only one team in Europe focusing on mobile health applications and mobile health sensors. Going further, our team in Grenoble was established last year, so it's a very young team. We are only 6 guys, focusing on medical sensors, which could be located in wearables. Under wearables, we mean like watches, glasses, and headsets. And our focus is on the technology which could be placed on the market within the next 3 years. So we are looking for very high level technology which could be implemented in our product very soon and will be bring to the market. Going further, I would like to introduce to you our health ecosystem, how we see it, how we would like to develop it. As I already mentioned, we are shipping every year 240 million mobile phones. Therefore, the mobile phone is our #1 device. And this device is always with the user. And the user can download an app which is called Huawei Health. It's available as an app for iOS system, for Android, and also for Harmony iOS. And therefore, it's possible to use it on any mobile phone. And the Huawei Health app can connect with wearable devices. It could be a device from Huawei, but also some external device. It's collecting the data, and it's also possible to connect it with external devices from the competitors, like, for example, personal fitness equipment in the gym. Then one can collect all the data in one place in one mobile app. Here on the slide, you can see some screens from the app. On the left side, you can see the main screen when one has wearable device from Huawei, and the app is collecting all the data in one place. It's the number of steps, heart rate, saturation of the blood, quality of sleep, and also stress monitoring is possible. And on the right side, you can see two screens of the sleep monitoring application, which is part of this Huawei Health system. When one is wearing over the night our band or watch, then the sleep is monitored, and in the morning one can see how was the quality of the sleep, which phases of the sleep were correct, which should be improved, and there are also some recommendations what one can do to improve the quality of the sleep and the length of the sleep. Going further, I would like to show you some examples of the devices which we have on the market. The simplest one is the Band 4. And this device can monitor our sleep over the night, monitor heart rate and saturation of the blood. So it's the basic device. The next one, more sophisticated one, is the Watch Fit. Additionally, here one has a bigger screen and also an animation of all trainings. So the watch is suggesting how one should make a training and is showing an animation to make it easier for the user to go through the training. And other products are watches. Watches additionally have microphone and speaker, so one can even make calls with them. Another device, which is not wearable device, but it's collecting some biosignals like bioimpedance and is giving us information about the composition of the body, is the Smart Scale. And on the bottom, we have two wearables, which are for now not which don't have medical sensors inside. It's a headphone and glasses. Here we are looking for new applications for them. Currently, we only have their speaker and microphone, but in the future, we will be also happy to implement there some medical sensors. It could be photonic sensors. So if you have any ideas, they are more than welcome, and more ideas and technologies. What about healthcare? Always very interesting topic and very important topic here is the data processing. Therefore, in our case, we are collecting all the data in one app. And this app is connected via Bluetooth to all external devices. We are collecting the data in one place, and here the user has the possibility to decide what will happen with them. The data can be transferred to the physician, to your doctor, or can be transferred to the cloud, or maybe in the future to some telemedicine center which can evaluate it. But in any case, the user has the right to decide what will happen with this data, if they should be shared with somebody, or if they should be kept only on the mobile phone. We are also doing many studies, like scientific studies with doctors, to see what could be the potential of our devices in the future. Because currently all our devices are only like fitness or wellness devices. They are not medical devices. We are also going in this direction